Hi guys, how are you all? Hope you all are fine. Hope you all are enjoying as always. God bless you. Today I prepared a topic which is called as a piles or hemorrhoids in very short. So what are these piles or what are the hemorrhoids? So piles or hemorrhoids, they are a collection of the inflamed tissues or muscles or fibers which contains muscle fibers which contains swollen blood vessels or veins. This is called as piles or hemorrhoids. Now, what are the types of piles or what are the types of hemorrhoids? Internal piles, external piles, and prolapse piles. So, what are internal piles? Internal piles are the piles which is about 2 to 4 centimeter above the anal canal. External piles, the piles which protrude outside the anus, which called as the external piles. Prolapse piles, the piles or hemorrhoids which keeps hanging outside the anus, they are called as the, especially in the third and the fourth stage, they are called as the prolapsed piles. So now we will study what are the causes of piles or what are the causes of hemorrhoids. The first and the foremost cause is the chronic constipation. The persons who hadn't taken treatment for constipation or chronic constipation, it results in the piles. Like in chronic diarrhea, pregnancy, straining during stools, then heavy weight lifting. These are the causes of the, and low fiber diet. This is very important. The patients who do not take fiber in their diet, they suffered for constipation, and this constipation eventually leads to hard stools, which causes later on piles. So these were the causes of the piles or hemorrhoids. Now we will see what are the clinical features of the piles or what are the clinical features of the hemorrhoids. First and the fourth, a painful lump can be felt at the area of the anus, which may contains blood or may not contain blood. So this is the first symptoms. If the piles contains blood, then it is called as a thrombosed external piles or thrombosed external hemorrhoid. Second symptom. Third symptom, there is a itch or there is a itchiness, redness, and soreness around the anus. Okay, there is a itchiness, soreness, and redness around the anus. Now, what is the? These were the symptoms. Now, what are the grading of the piles? The grading. When there is a very small inflammation and these veins are not visible, piles are not visible, then it is a grade 1. In grade 2, it is slightly greater than grade 1 with a visible piles. So during stool, they may come out. And what is the number 3? Grade 3 is a prolapsed hemorrhoid during stool. When the patient gives stress during stool, they get prolapsed and they can be easily reinserted in the anus. This is grade 3 piles. What is grade 4? In the grade 4 piles, the piles keep hanging outside the anus. This is it's non-reducible. It doesn't re-enters the anus. So these were the grades of the piles. Now we will see what is the differential diagnosis. What are the investigations of the piles or hemorrhoids? First is the per rectal examination. The surgeons, the mostly surgeons, they first in the piles patient, the surgeons, the first they will prefer the this thing PR examination or per rectal examination. Now what is this per rectal examination? See, the surgeons will insert a gloves and put a lubricating jelly in the index finger, and they will insert it in the anus to see whether the surrounded area is swollen or hard, or whether it contains tortuous veins. So this was the first investigation which is done clinically. It is called as a per rectal examination. Second, anoscopy can be done to visualize the anus. Then sigmoidoscopy to visualize the lower part of the colon and rectum. Then colonoscopy can be done to see the colon cancer. These were the investigations. Now, um, what is the differential diagnosis? In the differential diagnosis, first is the ulcerative colitis, then Crohn's disease, then this thing colon cancer. These were the differential diagnosis. Now, how are you going to treat? First is that area which has become red, swollen, itchy, Lignocaine ointment can be given, lock jelly, shield ointment, then this thing, any local anesthetic then should be given, which has is a homeopathic cream. It is very nice for the local application for external piles. Then hydrocortisone can be given if the external piles are very hard and bad. We can use steroid like hydrocortisone for the local application. Then what is the surgical treatment? And before surgical treatment also we can give NSAIDs to and NSAIDs to reduce the pain and inflammation. And also the very important treatment for the piles is the seeds bath for 20 minutes per day. And this thing, surgical treatment includes, there is a sclerotherapy and banding, the first one, okay, and the second is the hemorrhoidectomy, then stabbed hemorrhoidectomy, and this thing, electrocoagulation. So these were the treatment of the hemorrhoids. So what are the complications? See, in bleeding piles, that is thrombus external piles, because of the per-rectal bleeding, the patient's hemoglobin gets reduced and the patient may get anemic. Okay, so anemia is the first complication. Second is the blood clots can be formed, skin tack, strangulation of the hemorrhoids can be happened, and there will be fetal incontinence. So first complication is anemia. We have to stop the bleeding of the patient. We have to rule out the malignancies. So this was about piles and hemorrhoids. Hope you like the topic. I had made it very short, so that easily you could understand it. Mostly the layman's. Thank you so much. Love you lot. God bless you.